Hey everybody, I'm Dr. Prabhakar, OB-GYN, and today I'm going to be speaking about the Pap test. Now, I have so many patients ask me in the office, why don't I need a Pap smear every year? So let's break this down. Now, first of all, I put Pap smear in this title, but it's actually not a Pap smear anymore. It's a Pap test. This is a very fine point, but I do want to make it. In the past, when we did PAPs, we would take the cells and then the pathologist would literally smear it on a slide and look under the microscope. So it was a Pap smear. Now it's a Pap test. We have more fancy ways of doing it. We're no longer looking under a microscope from a smear. So it's actually a Pap test. And let's dive into Pap tests. Now, 15, 20 years ago, you would equate gynecologist with pap test, right? Like that's why you saw your GYN. That's what you did every single year. It was a routine thing. In fact, for many women, that's really why they saw a gynecologist. They didn't even think to ask other questions, or maybe they didn't have other issues. Their main thing was, okay, check, I got my pap smear or pap test done. So when did all of that change, and why is it that we don't need a pap every year? So these guidelines changed about 10 years ago, 10 to 11 years ago. So it's been a while, actually. This is not a recent guideline, but I feel like the country has not kept up with the recent guidelines, and it's taking a while for everyone to catch up. And we're still thinking, oh, PAP every single year. So these guidelines came out a while ago, and I want to review just the basic things with you, just so you know what's new. So the first point that we're going to talk about is the latest guidelines, right? So we start at 21. We no longer start at 18. We don't start PAPs when you're sexually active. We start at 21 for everybody. And this is because even if you've got something irregular or abnormal going on before that, because you're young, most patients will clear these abnormalities. And so by the time you're 21, this is cleared, or maybe you did have something abnormal when you were 18, 19. A couple years later it's gone, and um, this takes away some unnecessary anxiety and further testing when it really does not improve any outcomes. So something shows up abnormal, then you go do 10 more tests, then you're anxious, you're losing sleep, when in reality it like really did not make a difference. So we start at 21, and we do it every 3 years until you're 30. And then after 30, we actually space it out to every 5 years, and we add the HPV test. Okay. So from 21 to 30 is just a PAP, which is the little scraping of the cervical cells from the cervix. And it's done every 3 years. And after 30, we add the HPV test, which is human papilloma virus. This is the virus that causes cervical cancer. We test for that as well after 30, and then it's every 5 years. So this is the official guideline. Now, in reality, 5 years seems like a lot. So, in many practices, we do it every 3 years, including my practice. A lot of patients don't want to wait 5 years because maybe now they have a new partner or whatever, and they're older and they're worried that they're not going to clear the HPV or the HPV virus quickly, as they did in their 20s. And so now they just don't want to wait 5 years, which I think is reasonable. So most practices across the country will do it every 3 years. But if your doctor says don't have to do a PAP for the next 5 years, that is not wrong. Okay, that is actually the official recommendation. I have I have patients all up in arms. Oh no, my previous gynecologist said I don't need a PAP until 5 years. So that may very well be true. Now, that does not mean you don't need a GYN exam. Okay, so please don't get those two things confused. A PAP is something we do at the GYN exam. However, there are many other things we do at the GYN exam. We do a breast exam. We still feel your ovaries, your uterus, and we talk about other things, your bleeding and your periods and your fertility plans and menopause and all of that stuff. So don't skip your GYN exam because somebody told you you don't need a PAP for 5 years. Okay, you still go to the GYN. We're just not going to do the scrapey thing, every single year. So that's my first point to you guys, just about, let's get caught up on the new guidelines or newer guidelines, and when do we start, how often do we do it, and just the basics there. Second, let's talk about HPV. What is HPV? How does this relate? Why do we check it only at 30 and not at 21 when we first do your Pap? Okay, so HPV is human papilloma virus. It is the virus that causes cervical cancer. There are many strains of HPV. There are low risk strains, high risk strains, many tests to figure these out. And if you have a high risk strain, it can actually increase your risk of cervical cancer. And cervical cancer is not something that happens overnight. It's not like breast cancer, where one year you didn't have it, and the next year you have it, or maybe even colon cancer that pops up suddenly, or the many other types of cancers that can happen in our body. Cervical cancer is kind of a slow growing cancer. It grows over many years, 8, 10 years even, and often comes up in patients who haven't seen the gynecologist in a long time, or maybe may have skipped some screenings or skipped some visits, or unless they have a very very aggressive type of cervical cancer. It's otherwise a very slow growing cancer, and that's really why these guidelines are a lot more relaxed than something like breast cancer, for example, where we do recommend getting screened yearly. So HPV is human papillomavirus. If you get it when you are younger, 18, 19, 20, 25, you often clear it within the year because you have a good immune system, you're young and healthy. So even if you had it's not as active a few months later. After 30, it starts to hang around a little bit more. And that's why we add the HPV to the PAP after 30. So we really want to make sure we do both of those. Okay. And if you do have HPV, especially a higher risk strain, then we do recommend some further testing, maybe with a colposcopy, for example. So there are some next steps that we would do, but that's really what HPV is. That's why we test it after 30, and again, it's every 3 to 5 years. And there are several strains that you should know about: high risk, low risk. You could get the vaccine that protects against HPV. It's not 100%. So I've got many patients who say, "But I got the vaccine. Why do I have HPV?" Well, maybe this is a different strain. The vaccine protects against certain strains, but not all, and it's not 100%. And so it gives you a lot of protection, and everybody should get it. Now it's FDA approved for both men and women up to age 45. So it's a great thing. We should get it, but don't just rely on it and say, "Oh, now I'm just immune to HPV," because that is not true. Okay, so that's the deal on HPV and what you should know. Thirdly, and lastly, the PAP test is a screening only for cervical cancer. Okay, it does not pick up uterine cancer, it does not pick up ovarian cancer, it does not pick up colon or pancreatic or anything else. I have patients will tell me, "Well, I had the PAP, and so I'm good. It's screened for everything, all my GYN things," and that's actually not true. Only screens for cervical cancer. Now, if you are a postmenopausal patient and we see some endometrial cells in there, we think, if this patient is not having periods, why are there endometrial cells in there? And that may lead us to do a biopsy. In some cases, we have picked up uterine cancer or endometrial cancer from a PAP, but it was kind of an incidental finding. It's not the actual, that's not why we were doing the PAP. We were doing the PAP for cervical cancer screening. So I want everybody to be really clear on that. Don't miss your other screenings because you think this takes care of, all of it. So hopefully this has shed some light into the latest uh, guidelines, why you don't need a PAP every single year, how often you need a PAP, what HPV is, why do we test it only after 30, who is the vaccine for, and what can I do to protect myself against HPV and cervical cancer. So hopefully this video has helped you guys with some of these questions. If you have more questions about PAPs, HPV, cervical cancer, please post below and I will, make some more content around it. If you have a friend who had a positive HPV test, or maybe somebody with an abnormal PAP and they're just kind of confused about what all this means or how often they should be testing, please send them this video, tag them in this video, and I will see you guys in our next one. Okay, take care. Bye-bye.